the nurse-led model of care was a way of trying to improve evidence-based assessment of these patients. So what that involved was having a nurse who would ideally see patients either immediately before or after their oncology treatment. And the eligible patients were those who were aged 65 years and over, or a lower age group, 50 years or over for First Nations people. And the nurse would do a number of validated screening measures, specifically related to the geriatric domains. And then once that would happen, we would have a specific geriatric oncology multidisciplinary team meeting with the nurse, the oncologist, and also the allied health team members, where these concerns would be discussed. And if certain triggers were met, patients were referred either to allied health on an individual basis or for a more comprehensive assessment at a combined clinic. And then the findings of these assessments were discussed in order to see if the patients were fit for the original proposed treatment or whether this needed to be modified in any way. So this research was funded as research, so it has stopped. What we are currently doing is analysing the full results after 12 months to see what has happened to these patients, but we're also doing some retrospective comparisons with our medical-led model of care and historical controls with outcome measures such as hospitalizations, emergency department presentations, high-grade toxicities, because I guess ultimately I'll have to sort of build a business case to say that this is worthwhile doing, even though the evidence in the literature says it is worthwhile. But to advocate for this position, I'm going to have to come up with some hard endpoints.